This slide is of cardiac muscle. There are a few things you want to notice. One, the direction of the tissue, which does not distinguish it from anything else, but the direction of the tissue is left and right on the screen, and so the muscle would shorten, the left side pulling to the right side. But the thing you want to notice are these lines that are going perpendicular to the tissue. Each one of these cells is actually very tube-shaped, so you're looking at horizontal and vertical lines, but if we rotated this 90 degrees so that these cells were facing you, so the ends were facing you, you'd be seeing a bunch of circles because these are circular or cylindrical shaped cells. And so each one of these purple, darker purple or darker pink lines is actually the side view of a disc. So looking at like the side view of a frisbee, you can't tell that it's circular until you turn it to the right, turn it 90 degrees to the right or left. And so these intercalated discs are really important because they help the cardiac muscle cells communicate with one another, help with that electrical signal that's going to allow the heart to have the rhythm that it has and do its job hopefully correctly. Something else you'll notice on cardiac tissue that separates it from everything else except for skeletal muscle are these grooves that you can see going up and down too, a little more faint than the intercalated discs, but they are certainly there. It looks like if you ran your fingers across that tissue that they'd have like kind of little speed bumps, little ridges. Each one of these little ridges is the functional unit of muscle. We'll talk more about that in the muscle unit. You will also see some branching happening here, so the tissue goes mostly left and right, but you see some of these cells, and it's not too obvious in this slide, but it is in the other quiz. Some of the branching that takes place. Ignoring the white space, that's just space between the cells. Each one of these cardiac muscle cells has only one nucleus, and sometimes that can be hard to see with lots of branches and different layers of cells, but sometimes it's a little more apparent than others. So once again, this is cardiac muscle tissue.